Welcome back to the show. Today we're going to discuss a disease that has touched most of us at some point in our lives, whether it be a loved one, a friend, family. We're talking about dementia. Joining us is Russ Scala with Scala Precision Health. Russ, thank you for being with us.
Hi, how are you?
I'm wonderful. I'm interested to dive deeper into this topic. I have people in my own life who have been diagnosed. It's a terrible disease, and I know you had your own experience where someone in your life was diagnosed, which led you on this journey that we're going to dive into today. Can you share that story with us?
Yeah, when I was director of research for the large pharmacy, I got to travel around the United States and train the doctors and anti-aging centers on advanced hormonal and nutritional therapy. When my mom got dementia, I started looking at what her treatment protocol was, and that's sort of ground zero. I've developed protocols for people over 20 years, and what I want to say, this is information that your doctor and your neurologist isn't going to have. And do you really think a handful of medication is going to reverse a disease that has multiple metabolic functions that causes it? So that's sort of where we are. I act as a patient advocate. I send people blood work that they could ask their doctors about. And if they want, we develop treatment protocols for them because they don't know the questions to ask. And a lot of times they get led down a bad road. Dementia could be vascular dementia, where it's about blood circulation. Dementia can be nutritional problems. It could be hormonal problems, which mimic dementia. So I met with the leading neurologists in the United States, and I interviewed hundreds of physicians that take care of dementia patients. And really all they offer is medication. And what we brought together here is diet, nutritional, hormonal, looking at the microbiome, the second brain. The intestinal tract is a second brain. And every dementia patient is biochemically unique. So one treatment protocol isn't going to affect every dementia patient the same way. So we have to really listen, and we give the patients, when they call us at no charge, we give them a free consult, and we send them the blood work to order. And we sort of build a therapeutic relationship with people, because the caregivers who are taking care of dementia patients, they become patients because they're not trained to take care of a family member. And if they're a husband or a wife or taking care of grandparents, they're slowly watching a loved one deteriorate before their eyes, and that's devastating. And we developed an aftercare program for caregivers because they're stressed out and because they become severely deficient because they're taking care of a family member.
So you have a treatment protocol for the dementia patient, and you're also treating the caregivers.
Exactly.
Amazing.
Exactly. Yeah. Well, actually, a lot of this started back when we were developing treatment protocols for high-stress occupations, war vets, police, fire, and EMS personnel, because they have a completely different metabolism. So somebody under stress that's taking care of a dementia patient that's never taken care of anybody before, now all of a sudden they're put in this atmosphere that's just devastating them every day, and you don't get a lot of help. Memory centers are $8,000 to $10,000 a month. So with the hundreds of people we work with, we have reversed the symptoms, and some people think it's a miracle, and it's not. It's just that the neurologist didn't check and didn't do the right blood work. And once we corrected multiple metabolic markers in the patient that was diagnosed with early onset dementia, they started to respond to the therapy.
And we were chatting earlier, and you shared an incredible story, a perfect example of that, a gentleman that you witnessed, you helped through recovery. Could you share that with us?
Yeah, I had a really good friend of mine named John Kelly that was diagnosed with early onset dementia. I knew this guy was my best friend, and I knew he didn't have it, but everybody in his family said he did. The doctor said he did. And he started taking a handful of medication, but what nobody realizes was John was on a hormonal replacement program. We elevated all his hormone levels, thyroid, testosterone. We elevated his insulin. We lowered his insulin levels because dementia a lot of times is called type 3 diabetes. So we had him on an optimized program, and then he stopped. And when he crashed, that's when he got diagnosed with early onset dementia. So he lost 5 years. Now he's fine. But what I'm saying is he got taken down that road. The family believed everything the doctor said, put him on the medication, and he checked out. I mean, I met him a few times, and he looked right through me. Where I used to talk to this guy every day. He was a financial advisor, and we were designing longevity programs for his clients. So I know him.
Yep.
Okay, really well. So when I saw him go down that road, it was really devastating because everybody just sort of threw their hands in the air. So when people go to the doctor and they get a treatment, remember, a lot of stuff we're going to cover here in this poster, your doctor doesn't know how to do. All right? It's not a bad guy. It's not a conspiracy theory. Your doctor doesn't know how to look at the microbiome, the second brain, the gut. You are not what you eat, you are what you absorb. He's not going to be able to look at the ketogenic diet that could actually improve cognition, hormonal, nutritional deficiencies. Everything you put on your body that's a chemical can increase the symptoms. So no, this right here, I'm giving this away. Take it and run with it, because you're not going to get this information from your doctor. And if you trust everything your doctor says, you better get a second opinion, because physicians compartmentalize the body. They're just looking at the brain. They don't think about nutrition. They don't think about hormonal replacement. They don't think about the gut, the second brain. They're just looking at the brain, and they're making a diagnosis on early onset dementia, which thyroid, nutritional, hormonal deficiencies can all mimic dementia. So this is what happens, and a lot of people don't have it. And
so in your opinion, how many dementia patients do you feel are actually have been misdiagnosed?
I'm not sure of the percentage, but dementia is rising in the United States.
It absolutely is, yeah.
And there's a few doctors out there that actually are on the tip of the spear and talking about this. But I want to give the families an off-ramp. I want to give the families more research that they could take to their doctor. I want to help the families ask the tough questions. And then if they are caregivers, I want to show them how to take care of themselves.
And what are those questions, those tough questions that they need to be asking? How does the average person who maybe doesn't have a full understanding of these areas take that information?
What is the diagnostic criteria for saying my husband or wife has early on, or grandmother has early onset dementia? You know, have you checked, hormonal levels? Have you looked at the microbiome? Have you checked nutritional deficiencies that could mimic dementia? Just those questions alone can help the doctor think. And then we help the patient, we help the caregivers order blood work. We just send them the blood work at no cost. So we do a consult at no cost, and we send them the blood work to get at no cost. So we get calls from all over the United States. And if a doctor doesn't want to do the blood work most of the time, then ask them to document it in the record that they will not do this blood work.
Wow.
And then we'll make sure they get the blood work done.
And what success have you been seeing with your patients?
A lot of positive, it's very positive. A lot of doctors say that, a lot of people look at this like a death sentence, especially the people that have it. They're so stressed out. They think they walk into a room and they don't know why they walked into the room, which happens to all of us. As we age, 50, 60, and 70, we're all going to have cognitive decline. But my feeling is, look at multiple metabolic systems in the body that impact the brain chemistry, right?
Would you say there's a priority order here, or everything kind of all comes together and we need to look at each one? That's
a great question. I always say every dementia patient is biochemically unique.
Yeah.
So I spend a few hours listening to their history, all right? And I take notes, and it's sort of like dumping a puzzle out on the table. So as they're talking to me, I pull the puzzle pieces together for them, because there is no one treatment protocol. I had a neurologist tell me one time, a really well-known neurologist, saying we're never going to have a cure for dementia as long as the pharmaceutical company is looking for a drug to cure it. And some of these doctors, especially in Orlando, Dr. Arnaldo Isa was one of the leading neurologists in Orlando. when I was working on brain rehab programs, he came by my office. I had a little office at the time, and he's a rock star, but he still came by and he watched one of my PowerPoints, and he said, "This is really going to be the future of taking care of people, but my practice is too conservative for this." So he did take phone calls from me when other people were questioning my research. He would get on the phone and say, "Yes, it's spot on." So he was very helpful as I try to move this forward. Jump over to heart disease for a minute. Everybody says cholesterol causes heart disease. Well, we know now that's not true. So after 30 years of cholesterol-lowering drugs, now they're saying fat doesn't cause heart attacks. And so everybody's going, wow. Now there's cardiologists on YouTube and on the internet saying, nope, we got it wrong. It wasn't cholesterol. And then when you break it down and you find out that the liver makes about 800 to 1,000 milligrams of cholesterol a day. Every cell in your body is surrounded by a lipid bilayer. Your brain needs cholesterol in order to work. Then people start asking the tough questions. And now people are forming communities, social network communities, saying how to get off statins. Yeah. Right? So, and then another thing you can think about is heart disease is still the #1 killer, and cholesterol-lowering drugs came out in the 80s. Why is heart disease the #1 killer, right? So the same thing happens with dementia. They compartmentalize a disease. Actually, dementia, heart disease, diabetes, obesity is all really from the same cause.
So if we really just cared more about these areas, we would solve a multitude of things, it seems like.
Yeah, if people would, like I said, if people just focus on these areas, and we give the dementia patient, the early onset patient, the like vascular dementia where the circulation to the brain isn't working well the same thing happens to the heart. When the heart, the arteries become blocked because of endothelial dysfunction, the same thing happens to the brain, but the cardiologists and the neurologists aren't on the same page, right? So you get in your 60s or 70s, you end up with 5 different doctors, and none of them talk to each other. So we want to go to the family, cut to the chase, give them what they need, and get on a path to wellness while taking care of the caregiver, because they're cast into an atmosphere that they never expected was going to happen in their life. It really devastates the whole family, and we could put the brakes on that.
Absolutely. So I'm sitting at home, I'm hearing you speak, and I'm like, this guy is giving away all this free information, free blood tests. I want to be part of this. I want to bring my loved one to Scala Precision Health. Where do they get started with this?
You go to my website, Scala Precision Health. I've got a YouTube channel, a Russ Scala YouTube channel that there are hundreds of videos on there that you could review. I've been doing the YouTube channel for like 10 years, just putting information up there. But make a phone call. It may be the most important phone call of your life and for your family. And when you call me, just have a pen and start taking notes, and we'll get started and get you on the right path.
Amazing.
Because I know this isn't being done to dementia patients.
But we're doing it at Scala Precision Health.
That's right, exactly.
That's wonderful. Thank you so much for your time and for sharing your knowledge with us and giving away really all of this free information. We appreciate that. Thank you.
Yeah, well, like I said, I appreciate you, and I went through this myself, and I know how devastating it was to my family. So if I could help others with information I already have sitting in files, then game on.